Everyone, did you drink a glass of water right after waking up this morning, as usual? If so, you may need to stop and reconsider that habit. Did you know that a single morning routine can slowly damage your kidneys and eventually result in lifelong dialysis? This conclusion comes from a 10-year follow-up study conducted by the nephrology research team at Seoul National University Hospital. According to their findings, 7 out of 10 people over the age of 60 practice morning habits that seriously harm kidney function. What makes this even more concerning is that the kidneys are silent organs. They do not send warning signals until nearly 70% of their function is already lost. As a physician with decades of clinical and research experience, I have worked across multiple fields, including brain science, emotional intelligence, diabetes, metabolic disorders, urology, and health and longevity after age 60. Through treating countless patients, I have come to understand how closely the brain, body, hormones, metabolism, and emotions are interconnected, shaping our decisions, behaviors, health, and overall quality of life. Today, I want to share the insights I've gained from years of clinical work, research, and carefully listening to each patient's story. For over 30 years, I have witnessed patients' final stages of life almost daily while working in the nephrology department of a university hospital. As a doctor, it deeply pains me to see patients lying in dialysis units, wishing they had learned the truth earlier. That is why I am here today, to share a natural recovery method that hospitals rarely teach, largely because it isn't profitable. It's not an expensive drug or a risky surgical procedure. It's simply a spoonful of honey from your own kitchen. You might be tempted to laugh and dismiss it as just honey, but this simple substance has surprised even the medical community. Have you noticed that your urine has become foamy rather than clear? Do you wake up with swollen eyelids or ankles? Are you losing sleep because you constantly need to urinate at night? Does your lower back ache intensely, making everyday discomforts feel unbearable? This isn't just a normal part of aging. These are emergency signals indicating that your kidney filters are damaged and allowing vital proteins to leak out of your body. Today, I will explain 5 key points. First, the remarkable principle behind how honey helps restore damaged kidney filters. Second, 3 common mistakes in honey consumption that actually harm kidney function. Third, the 3 most effective times to consume honey. Fourth, critical consumption errors you must avoid. And fifth, who should never consume honey. If you stay with me until the end, you may find that nighttime bathroom trips decrease and that you wake up feeling lighter and more refreshed. Let's begin. Does honey protect your kidneys? Let's explore the mechanisms by which honey can help revive damaged kidney filters. Before that, many of you may be thinking, Doctor, isn't honey basically sugar? Aren't older adults told to avoid sweets to protect their kidneys? Those concerns are understandable. 30 years ago, when I was a medical resident, I was the same type of strict doctor who warned patients to completely avoid anything sweet. This is one of the blind spots of modern medicine. Medical textbooks often classify refined sugar and honey as identical simple sugars. However, my clinical experience revealed a very different reality. Refined white sugar acts like a harmful toxin. It damages blood vessels, triggers inflammation in the kidney's filtering units, and provides short-lived, unstable energy that quickly crashes. Honey, however, is fundamentally different. It is not simply sugar water. Honey is a natural substance produced by bees collecting nectar from countless flowers, containing over 180 active enzymes, along with vitamins and minerals. It provides steady, gentle energy, much like a slow-burning wood fire, nourishing kidney cells at a cellular level. The antioxidants in honey help cleanse the tiny blood vessels within the kidneys, removing accumulated oxidative damage. As we age, reduced kidney energy contributes to weakness and reduced urinary flow. Honey helps address this underlying energy deficit. Unlike sugar, which causes a sudden spike and crash, honey supplies balanced energy that supports kidney function quietly and efficiently. This is not folk wisdom. Numerous international studies have already confirmed honey's anti-inflammatory properties and its role in tissue repair. So how exactly does honey revive declining kidney function? Let me explain the mechanism step by step. E-healing effects of honey can be summarized in 3 major actions. Understanding these principles is essential if you want to apply them consistently and effectively. First, honey provides strong antioxidant protection that reduces inflammation in the kidney filters. Each kidney contains roughly 1 million microscopic filtering units called nephrons. These filters remove waste from the blood while retaining essential nutrients. Over time, factors like aging and high blood pressure cause oxidative stress to accumulate, damaging these filters. As the structure weakens, protein begins to leak into the urine. Honey contains flavonoids and polyphenol that travel through the bloodstream to the kidneys, helping neutralize oxidative damage and calm inflammation. Animal studies have shown that regular honey consumption reduces kidney cell injury and improves filtration efficiency. Second, honey supplies clean, immediately usable energy. The kidneys are among the most energy-demanding organs in the body. Many common carbohydrates, such as bread and rice, generate waste during digestion, increasing the kidney's workload. Honey, already broken down into monosaccharides by bees, is absorbed directly into the bloodstream. It provides instant fuel without digestive strain, similar to switching from polluted fuel to clean energy. This helps restore filtering capacity and reduces swelling and fatigue. Third, honey acts as a natural antibacterial agent. Urinary tract infections are a hidden contributor to kidney damage, especially with age. Honey contains glucose oxidase, an enzyme that produces small amounts of hydrogen peroxide, creating an environment that inhibits bacterial growth in the kidneys and bladder. This natural defense reduces infection risk without contributing to antibiotic resistance. Together, these effects make honey more than a food. It functions as a comprehensive nutritional support for kidney health. However, even beneficial substances must be consumed at the right time. Based on 30 years of clinical observation, I will share 3 optimal times to consume honey for maximum kidney benefit. The first ideal time is immediately after waking on an empty stomach. During sleep, the body becomes mildly dehydrated and the kidneys work continuously. Drinking cold water abruptly can stress them. Instead, dissolve 1 spoonful of honey in lukewarm water around 40 degrees Celsius. This gentle drink helps flush waste accumulated overnight while providing immediate energy to the brain and kidneys. Many patients report clearer urine and reduced morning heaviness within a week. The second ideal time is in the afternoon, after lunch, when fatigue sets in. Many people reach for sweetened coffee at this time, but caffeine promotes dehydration and strains the kidneys. Replacing it with warm honey tea provides steady energy without dehydration. Adding a slice of lemon enhances the effect, as citric acid helps prevent kidney stones and reduces fatigue. Many people notice reduced swelling and improved energy after making this switch. The third ideal time is about 1 hour before bed. Rather than drinking large amounts of water, take a small spoonful of honey or dissolve it slowly in the mouth. Nighttime urination often occurs because the brain senses low energy during sleep. Honey replenishes energy stores, allowing deeper sleep and reducing stress hormone release. During deep sleep, hormones that suppress urination are released, giving the kidneys time to rest. Many patients who previously woke multiple times per night found their bathroom trips reduced to once, or not at all. Remember this rhythm. Honey in the morning to cleanse, in the afternoon to restore, and at night to promote rest. Even so, improper use can negate all benefits. The first major mistake is mixing honey with boiling water. High heat destroys honey's enzymes and nutrients, turning it into ordinary sugar water. Always allow water to cool to warm temperature before adding honey. The second mistake is overconsumption. Excessive intake causes blood sugar spikes, forcing the kidneys to work excessively. 1 to 2 spoonfuls per day is sufficient, and honey water should taste mildly sweet, not concentrated. The third and most dangerous mistake is consuming adulterated honey. Cheap honey often contains added sugar or syrup and lacks beneficial compounds. Genuine honey sinks and clumps in cold water, while fake honey dissolves easily. Always choose reliable, natural sources, even if they cost more. Avoiding these mistakes allows you to receive the full benefits of honey. Honey also works well with complementary foods. Adding lemon or natural vinegar helps alkalize urine and prevent kidney stones. Cinnamon powder, which warms the body and improves circulation, enhances kidney blood flow, especially helpful for those sensitive to cold. These combinations amplify honey's effects without added cost. Weaver, honey is not suitable for everyone. Patients with advanced kidney failure, especially those on dialysis or with strict potassium restrictions, must avoid honey due to its potassium content. Those with poorly controlled diabetes should only consume honey under medical supervision and in very small amounts. Finally, honey should never be given to infants under 12 months due to the risk of botulism. Outside of these cases, honey can be a valuable natural aid. Now that you understand the principles, the next step is seeing real-world results. In the final section, I will share the story of a patient whose life changed through these practices, a story that may reflect your own future.